Okay, so I am back for the final stage of the therapeutic process, which is maintenance and discharge. So I like to think of maintenance and discharge as you've pretty much met your goals. There's not a lot happening in between sessions, or if there is, it's sort of one-off stressors, circumstances, but you're able to use the tools, self-regulate, move through the challenging situation with minimal support. So you might be like, Lynn, what does that even mean? So typically what happens as you're nearing what is probably the end of your therapeutic relationship for this episode per se, you'll notice that you're sort of coming to session and there's really not a lot to talk about. You're pretty much implementing what you've worked on in between sessions. And so what I usually do at that point in time with my clients is have a conversation around stretching out sessions. So maybe we'll go from weekly to every 2 weeks, 3 weeks, month, just depending on what the client thinks would be beneficial. And we test that for a few weeks, months. As long as everything still is going pretty well, again, it doesn't mean that life is perfect, that you're not having challenges, but when challenges arise, you're able to move through them. You're not having significant setbacks or regressions. Then the next conversation that we'll have is discharge. It's time to say goodbye. And when you want to come back and get more support, then you can come back and see